I have a list here of published scientific studies, the Journal of Neuroorthopedics of whiplash patients, and it says the authors reported 62% continued to suffer from significant pain and symptoms attributed to their motor vehicle collision 12 and a half years earlier. Hi, I'm Dr. Michael Pasternack, a chiropractor with Winchester Spine and Injury, here today to talk about whiplash and chronic pain after a car accident. This is from 2002, the European Spine Journal. It did a 17-year study on whiplash-injured patients, and the authors reported 55% of these patients continued to suffer from residual pain 17 years after the injury. The consensus is about 47%, so half the people are going to have chronic, and here's the key word, significant aches and pains even 30 years after the car accident. I've been in practice 31 years. I've had over 10,000 new patients during that time, and it fits exactly with what the studies are saying. So half of those people, those 10,000 new patients, they relate back to me that their aches and pains started after a car accident. Sometimes it's a recent car accident, but often it's, they had a car accident 10, 15, 20 years earlier, and they've had chronic pain ever since then. The concerning thing for me is these people, they've had care. It's not that they've sat at home and done nothing. They've been to chiropractors, they've been to physical therapists, they've been to their family doctors, to specialists, but still half of them have ongoing significant aches and pains. I don't know, that really bothers me. Especially now, since I've been in a car accident, and if you've been following me on social media, you see some of my videos. I don't want to be one of those 50% that has ongoing, chronic, significant pains. Heck no, that's not acceptable for me, and that's not acceptable for my patients. And that's why 4 years ago, I decided to specialize in auto injuries. And so I've taken some pretty advanced coursework specializing in auto injuries, and I talk about that on other videos, but what it really comes down to is diagnosis and specialty training. Someone could have an ache or a pain, let's say in their elbow, just as an example. You could probably come up with 10 or 20 different diagnoses for that elbow pain, and they'll all be valid, but some of them are going to be much more generic, and maybe a couple of them are going to be much more specific. The more specific you start getting in your diagnosis, the more targeted your treatment can become, which is then going to be more effective. Or you could say the same thing the opposite way. The more generic your diagnosis, the more treatment is going to be generic, and your results are going to be sort of generic. And it's not surprising that maybe half the people would still have problems if they were just having generic diagnosis with generic treatment. What I sort of focus in on is, with my advanced specialized training in things like MRI, orthopedics, spinal biomechanical engineering, spinal pathology, accident reconstruction, those are just some of them. This lets me look at the information in a little different light. It helps me to take it to the next level and really think like, okay, so what structures are involved? Instead of just saying it's back pain or non-specific back pain, I'm thinking, all right, I know there's like 6 or 7 pain generators in the back. Which one is it, right? Is it the disc? If it is a disc, is it a bulging disc? Is it a herniated disc? Is it a extruded disc? Because those would all be different treatments, right? Is it do you have torn fibers or annular fibers? Is it a leaking disc? Or is the problem more the nerve, right? Is it the nerve root that's inflamed? Is it a chemical irritation? Is something actually button up against it? Is it the facet joint? Is it the ligament? Is it an overstretching of the ligament? Is it a tearing of the ligament? Is it the muscle? So there's a lot of different things that could cause issues. And so it's opened my eyes to really looking at what other diagnostics can I do that's clinically warranted so that I can really come up with the most accurate and specific diagnosis, because then we can get the most targeted treatment for the patient, which is going to lead to the best outcomes. The strange thing, maybe not strange, is, because I sort of specialize in this and I do what I call quarterbacking, which means I'm like managing the case. I have some patients that come in that, I do a really thorough history and exam and I figure out what's going on. We get additional testing and it comes back that, with the diagnosis and the issue they have, the type of care I do isn't really what that patient needs. And so I may not even treat that patient. I'm just quarterbacking and managing it, and I refer them off to the proper specialist so that they can get the care. But I'm filling a unique role that really nobody in this area is doing, and it's something I enjoy doing. Until about 5 years ago, we had the International Classification of Disease, the ICD-9 codes, and that's what clinicians would use to diagnose things. And about 5 years ago, the government said, no, that's not accurate enough. We need the ICD-10, which has 4 to 5 times as many diagnoses. So they recognize the fact that the more specific the diagnosis is, the better the outcome's going to be. And so in the spirit of things, that's what I do with my training. Dr. Michael Pasternack here with Winchester Spine and Injury. If you've been involved in a car accident, I'm happy to help in any way I can. If you're here locally, I can treat you as well as manage your case and quarterback it. If you're not here locally, I could still quarterback and help manage your case for you and make sure that things are being done the way they need to. So have a great day. Follow us on social media, Dr. Michael Pasternack.